Kenyatta has launched an ultra-modern mother and child hospital in Wote, Makueni County. Now, the facility, which has a capacity of 120 adult bed spaces and 80 children bed spaces, is expected to deliver specialized care to expectant mothers, infants and children. This facility is launched even as Makueni marks several milestones in maternal healthcare. Hospital deliveries have improved from 19% to the current 60%. This initiative is in line with First Lady's Beyond Zero campaign, a flagship program aimed at saving the lives of mothers and children by preventing unnecessary maternal and child deaths. So far, 60,000 patients have been attended and 7,000 screened in Makueni's Beyond Zero clinics, a flagship program aimed at saving the lives of mothers and children by preventing unnecessary maternal and child deaths. The campaign also aims to eliminate mother-to-child transmission of HIV by 2020, besides scaling up the war against new HIV infections amongst adolescents. Now, the inaugural FLHM, that's the First Lady Half Marathon, was held in March 2014, followed by two other successful events in 2015 and 2016 before taking a break. Well, it is a milestone for Makueni County, and let's join our reporter Caroline B, who has been following up on this opening up of the facility in Wote Town, Makueni County. Now, Caroline, many thanks for joining us. Bring us up to speed with perhaps the benefits that the residents of Wote Town and Makueni County at large are set to benefit from this particular facility.
Well, Jesse, this is a big milestone for this county, given that it's been in the forefront in promoting healthcare in this county. Remember, 4 years ago, they came up with this program that they subsidized healthcare. They subsidize healthcare for the population in this county, not only for the residents, but also other visitors who stay here for 6 months. And today they have launched the Mother and Child Hospital, which will be offering reproductive health services to women and also children in this county. And this hospital has a bed capacity of 120. It will offer a lot of services related to women and to children to reduce their deaths, which has been a problem in this country. So right now I'm joined by the committee executive member of the health the CEC of health rather in this county to give us more information about this program and what they hope to achieve in the coming years. So thank you very much for joining us, Mr. Andrew Mulwa. Maybe you can start by telling us why did you choose to come up with specifically a mother and child hospital?
Thank you. Today is a big day for the people of Makueni because we have officially opened a mother and child hospital, which is 120 adult facility and 80 neonatal beds, and therefore this opens a new chapter in terms of how maternal and child health services are done, not just for Makueni County but for the region. The reason why we focus on maternal and child health is one, as a county government, we realized our biggest problem in 2013 when we came in was issues of maternal and child health. That just 19% of mothers were able to deliver in health facilities, and under 30% of facilities would actually conduct a delivery. And what happened is we thought, how do we change this? So we decided to invest in all areas of health service delivery, investing in health infrastructure. We decided to do a big center of excellence. That is what we are launching today for mother and child. We also did maternity blocks, 62 of them across the county. We also opened up maternity rooms or delivery rooms across all our dispensaries, so that from 109 total facilities that we had in 2013, we increased the number to 232 now operational, and we also add maternity services from 37 to the 232. So it's a big focus that we focus in on ensuring our mothers and children, and that has really improved the indicators for health in the county, so that more mothers are able to deliver under skilled birth attendants. We are employing more healthcare workers every year. we are employing 150 to 200 healthcare workers, and this has increased our numbers of healthcare workers from 863 in 2013 to now 1,767. So we are investing in all pillars, and infrastructure is one of the key areas where the public health sector has been neglected, and we thought we need to have a center of excellence, a facility that can be a referral, not just for Makueni, but a referral for the smaller facilities in Makueni and the region. Neighboring counties of Kitui, Machakos, Kajiado, and Taita Taveta are able to refer here. We will have state-of-the-art equipment. We have theaters, we have specialists who are able to undertake all the specialized services that our patients from the region require.
So maybe a final question. In terms of, you've actually been considered a role model for the county in terms of healthcare. So how do you plan to maintain that as a county, given that, you know, there are 47 counties and each one of them is trying to be visible out there?
Yes, first we have accepted and we help other counties learn, so that because once Makueni is doing well and the other counties are not doing well, the country is not doing well, and we suffer the consequences because patients like right now travel from as far as Taita Taveta, Kwale, Kilifi, and come to utilize our services. So if the health services in the neighboring counties or everywhere in the country is good, we are happy. So therefore, it's a healthy competition. We are happy when other counties do even better than us. Then number two, we also have a shift of focus from now the curative services to primary healthcare. We want to reduce the number of patients who actually come to the facilities by going back to the communities, and we have an elaborate plan. In the next 3, 4, 5 years, Makueni will be famous for the community health strategy that we are going to roll out, so that we are going to attach health workers to households, so that a health worker is responsible for a given number of households, and when they visit the facility, it is the healthcare worker to be responsible for that population. And this, I'm sure, will change the dynamics of not just how healthcare is delivered in Makueni, but how it is delivered in this country. So there's another frontier that we have not ventured.
Let me just cut you short. So thank you very much, Bwana CEC, giving us more information about the unveiling or the commissioning of this mother and child hospital, which was officially opened by Her Excellency, the First Lady Margaret Kenyatta. And it is a big milestone for this county in terms of reducing maternal and child mortality rates in this county. It's been a role model. Well, that is according to the governor, Professor Kivutha Kibwana, who not only has gone a step forward in ensuring that healthcare in this county is up to the level that is required. Back to you, Jesse.
Thanks, Caroline B. Always a pleasure, and I'm sure the region and Makueni as well will definitely benefit from the mother and child hospital that has been launched.